given the current economic situation, would either of you now favor controlling health care costs over expanding health care coverage? The question is first to Senator Obama.
We've got to do both. And that's exactly what my plan does. Look, as I travel around the country, this is the issue that will break your heart over and over again. Just yesterday, I was in Toledo shaking some hands in the line. Two women, both of them probably in their mid to late 50s, had just been laid off of their plant. Neither of them have health insurance. And they were desperate for some way of getting coverage because, understandably, they're worried that if they get sick, they could go bankrupt. So here's what my plan does. If you have health insurance, then you don't have to do anything. If you've got health insurance through your employer, you can keep your health insurance, keep your choice of doctor, keep your plan. The only thing we're going to try to do is lower costs so that those cost savings are passed on to you. And we estimate we can cut the average family's premium by about $2,500 per year. If you don't have health insurance, then what we're going to do is to provide you the option of buying into the same kind of federal pool that both Senator McCain and I enjoy as federal employees, which will give you high quality care, choice of doctors at lower cost because so many people are part of this insured group. We're going to make sure that insurance companies can't discriminate on the basis of pre-existing conditions. We'll negotiate with the drug companies for the cheapest available price on drugs. We are going to invest in information technology to eliminate bureaucracy and make the system more efficient. And we are going to make sure that we manage chronic illnesses like diabetes and heart disease that cost a huge amount but could be prevented. We've got to put more money into preventive care. This will cost some money on the front end, but over the long term, this is the only way that not only are we going to make families healthy, can't afford these escalating costs.
All right, Senator McCain.
Well, it is a terribly painful situation for Americans. They're seeing their premiums, their co-pays go up. 47 million Americans are without health insurance in America today. And it really is the cost, the escalating costs of health care that are inflicting such pain on working families and people across this country. And I am convinced we need to do a lot of things. We need to put health care records online. The VA does that. That'll reduce costs. We need to have more community health centers. We need to have walk-in clinics. The rise of obesity amongst young Americans is one of the most alarming statistics that there is. We should have physical fitness programs and nutrition programs in schools. Every parent should know what's going on there. We need to have employers reward employees who join health clubs and practice wellness and fitness. But I want to give every American family a $5,000 refundable tax credit. Take it and get anywhere in America the health care that you wish. Now, my old buddy Joe the plumber's out there. Now, Joe, Senator Obama's plan, if you're a small business and you're able, and the guy that sells to you will not have a capital gains tax increase, which Senator Obama wants. If you're out there, my friend, and you've got employees and you've got kids, if you don't adopt the health care plan that Senator Obama mandates, he's going to fine you. Now, Senator Obama, I'd still like to know what that fine's going to be. And I don't think that Joe right now wants to pay a fine when he is seeing such difficult times in America's economy.